welcome to the interview. Today I'm having the privilege and pleasure of talking with Tiffany McEwen, and I guess we'll just jump right in, Tiffany. Why don't you introduce yourself to the audience? Where are you working? How long have you been a grad?
Sure. So my name is Tiffany McEwen. I'm the past president of the Canadian Nursing Student Association, and I'm working as a registered nurse in an emergency department in Kingston, Ontario. I've been a nurse since January of this year, so about 8 months now. So it's been a really interesting time.
Well, that's exactly what we're going to talk about today. And 8 months is a really good place. So, do you feel like you're in a better place because you're in that third stage? You feel like you're in a better place than you were when you started?
Oh, absolutely. Yeah. I would say somewhere between like 4 to 6 months in is when it started to feel a little bit easier. Like I started to settle into my role, and stopped feeling like every day was really overwhelming. So I feel like now at 8 months, I'm really getting the flow. I've learned a lot of new skills, and I'm really just in that point where I can start to refine and develop them and add a few extra skills to my skill set. So definitely feeling a lot better now than I was in the first and second stage as a new grad, for sure.
Absolutely. What a relief, hey?
Yes.
My, why don't you talk about your entry into practice? And was emergency where you'd planned to go? How did that process unfold for you?
Yeah, so funny enough, when I started nursing school, I said keep me as far away from the emergency department as humanly possible. Like it's too much chaos. I don't think it's for me. And then the longer I was in nursing school, the more I felt like I needed a little more like of a fast pace, I guess. I needed a little more opportunity to use my clinical judgment and sort of make a lot of really like quick calls. And so when I was in my third year, I took a critical care elective so that I could consolidate in the emergency room. So I did my final consolidation in the same emergency department where I work now. So that was sort of my like entry point. Um, but certainly it was not not always a smooth entry, let's call it that. I'm very glad to have consolidated there. I think that really helped me a lot. But it is a very fast-paced environment. There's a lot of things that are changing. People are decompensating. Um, so it was a bit of a rocky start some days. You leave after 12 hours feeling truly and utterly exhausted, physically, mentally. Um, so that first few months was challenging. I would say I left after every set feeling like, oh my gosh, I am bone tired. I've never been so tired in my whole life. And it's because you're just learning constantly. You're constantly learning new skills, and you're learning new approaches to everything, and you're juggling all of these new things that you didn't have to juggle in such a quantity before. um so yeah, it was it's been good, but definitely came with its challenges.
So, how did they bring you in? Because what I'm learning about some of the emergency rooms in the country are that they're able to contain and control some of that experience for the new grad by ensuring they're not in triage, ensuring they're not in the recess room, ensuring they're some emergencies actually have like an urgent care area. And so they're putting grads in the urgent care area, which is quite contained. What happened for you?
Yeah, so it's a very similar process. The hospital where I work has a really extensive orientation process, which was great. I think I got 24 orientation shifts, where I was with a mentor, which was so valuable to me. But we are not trained in the trauma and resuscitation areas until about a year in, and then you're not triage trained until about 2 years into your employment at this hospital. And that's for your safety as well as the safety of the patients. You have to be able to recognize the signs of decompensation and be comfortable in the environment, before you can really start having to do traumas and triaging. So that's really helped support me and make sure that I felt like I could take care of the patients that I had in a way that was like safe and effective. So I work at a very large facility, and we have several different sections in our emergency departments. We have four sort of distinct areas. We have the resuscitation area, where I don't go. And then we have sort of an ambulatory care area. It's sort of like fast, easy turnover things. We have sort of the middle ground, which is where things that take a little more investigation will go, but those patients are generally expected to be treated in the ED and then leave. And then we have an area that's sort of transition to beds. So more like the floor would be like a regular nursing unit, but contained within the emergency department for those folks that are waiting for placement upstairs.
Okay. And so where are you in all of that? Like, where are most of your shifts occurring?
I would say like the majority of my shifts are between the transitional area and the more like thorough investigative area, but I do go to the ambulatory area as well. The nice thing is we kind of get moved around a little bit so you don't get sort of stuck doing one type of care all the time. They're quite good about making sure that we have an opportunity to experience different areas and get a taste of everything, and also just not get sort of locked into one spot.
Right. And you said you attended some sort of a training process for the emergency room. Was that as a student or was that once you were a graduate?
That was once I was a graduate. So I did my consolidation, which was 12 weeks. And then when I got hired, there is a lot of like onboarding shifts, a lot of training for the organization. But then there were 24 shifts where I was paired directly with a mentor, before I ever transitioned to being a nurse by myself, um, which was really, really helpful having somebody there. And obviously, as you work your way through the orientation shifts, they start to give you more freedom and more leeway, and they're more of a supporting role to you instead of them being the primary nurse and you sort of taking on one or two patients. And by the end of the orientation, it really helps you to feel empowered to have your full patient assignment. Um, and you feel safe doing so.
So you're saying basically that at the end of that 24 hours, not 24 hours, but 24 shifts, which is a nice amount, what would that last? About 3 months at least?
It's between 2 and 3 months, depending on how many shifts you have. We do, at my organization anyway, we do 2 days, 2 nights, 5 off. So sort of depending on where your shifts fall, it takes somewhere between 2 and 3 months of orientation.
Sure. Okay. And did you feel ready then to kind of take on your own load? What was that transition like for you after the mentor was like, okay, you're ready?
Um, yeah, I want to say yes and no. I knew somewhere in my mind that I was ready. I was taking, by the end of the orientation, essentially the whole patient load. And my mentor was sort of there just to make sure I didn't flounder. But there's always going to be a part of you, I think, that when you make that transition to care, you're like, I don't know if I can do this. I don't know if I'm ready. Like people are depending on me. Um, so that first shift, I would say, off orientation was probably one of the most terrifying days of my life. But I quickly came to realize that even though I wasn't on orientation anymore, I wasn't alone. There's always people that I can talk to. There's always people I can ask for advice. Um, we have a very solid camaraderie in our area. And I think that that is such a valuable piece of the puzzle, for new grads, is having a supportive team that you can go to and say, listen, I've never done this skill before. Can you help me? I've never come up against this thing, or I'm I think this is what I need to do, but I'd like to bounce an idea off of you. So having that support really made that transition easier. But I would say there was definitely a point where I was like, I don't think I'm ready. But I think that we underestimate ourselves because it's such an important thing that we do, and people's lives realistically do depend on us doing our jobs correctly and well. It's a very scary leap into being on your own.
It absolutely is, because it is a big leap, right? And it's a huge responsibility. So not feeling that would almost indicate that you don't realize that. So I think that's very natural. So when you transitioned from the support of a mentor, kind of one to one, and where are you working in the country?
Kingston, Ontario.
Kingston, yeah. So Ontario has the new graduate guarantee. So that is sort of what you were experiencing, was it? Were you in the NGG?
I actually was not part of the NGG specifically. Our hospital just offers a very similar program for certain areas. So while I wasn't part of the actual NGG program, it's a similar sort of process that the hospital offers.
Sure, sure. So I think they go to 3 months. So you went somewhere between 2 to 3 months. So that sounds reasonable. So did you find that after you transitioned into doing your own work, were you still kind of connecting with that one mentor, or had you by then sort of started to reach out to anyone who was available?
I would say in the first maybe couple of weeks, I leaned pretty heavily still on that original mentor, but I had at that point been able to make connections with the people that were on my line. So I was able to orient on the line that I would be working on, which was really nice because I could get to know the people that I would be working with all the time. And so it didn't take very long before I knew that I could go to pretty much anybody. And we already sort of had those relationships built from the time that I was orienting. But I would say that in that first maybe week or two, I would have leaned more heavily on my original mentor than the other colleagues on my line for sure.
Well, that's a really good point, Tiffany. This idea of, because I don't think people realize that you don't always orientate on the line to which you're going to go. So I think it sounds to me like you're saying that that's almost this extra layer of long-term support because you get to know a lot of the people that you're going to continue to work with. I think that's a really interesting point.
Yeah, it definitely is a piece that I think gets overlooked sometimes, especially with the challenges that we have with staffing. It's not always feasible to train somebody on the line that they're going on, but I think it's such an underrated component to the new graduate transition that's so important. Because sometimes we work monkey shifts, so basically a shift in the middle of the time off, and those folks are not from my normal line. And the first couple monkeys were really challenging because I didn't know who had extra skills that I could go to, who I could ask questions to. I wasn't really familiar with the charge nurse that was on. So it's sort of an undervalued piece of the puzzle that I think, unfortunately, just given the challenges we're having with staffing and training right now, is not always something that people have the privilege of having. So I would say that it definitely made things a lot more smooth for me.
Well, I really appreciate you bringing it up, right? Because people who watch this are looking for, okay, what are the tips that I can think about when I'm going to be in that same situation? And that's one of them. So thanks for that.
Mhm.
So, Tiffany, was nursing what you thought it was going to be?
Yes and no. Again, I'm gonna give you a lot of like yes and no answers here today, I think. Um, I would say in a lot of ways it's more than I imagined it would be. I was a later in life nurse. I didn't start out in nursing. I actually was a photojournalist before I was a nurse. And so I sort of had the privilege of some life experience that allowed me to know that nursing was what I wanted to do, that it was where I wanted to go. Um, and definitely there have been surprises along the way. I think a lot of people have this idea of nurses as just doing hands-on skills at the bedside, but there is so much more to nursing than I could have ever possibly imagined or been prepared for, even in school. Making the human connections, supporting your patients and your families emotionally, not just physically. We think of nursing as a very like physical career a lot of the time, but it's not just physical care. You're doing a lot of emotional care, a lot of mental care. Um,
Yeah, that's
and so that's something I guess I just didn't really, it was more than I expected, but it's such a privilege to be able to provide that kind of care as well. So,
That's how I always felt in my career when I was working intensely as a critical care nurse and then a transplant coordinator and whatnot. People's lives at those moments are so vulnerable, and the families are as vulnerable as the patients in different ways. And so I found that connection took a long time for me to start to build skills as to how to connect with these families and support them in a way that was helpful to them.
Yeah, I would say that's definitely still an area where I am growing and learning every day is how can I support my patients and their families in a more effective way? Because nobody really comes to the emergency department on their best day. Most people come to see us because they're having one of the worst days of their lives. And so we have to work to protect that, and to support them in whatever ways they need to be supported. And I think oftentimes people forget that there are families behind the patients as well. So that's another sort of layer of things that I think people don't necessarily always think about, is that you're not just caring for one person, you're caring for a unit of people a lot of the time.
Yeah, that's very, very interesting insight. And I think some of it has to do with the ownership, right? The fact that you on your own are responsible for what happens to this patient and this family. And you sort of take on this embrace of that experience that you don't necessarily feel as a student. There's all these other people around, they're following you, they're checking up, but now it's just you. So that tremendous sense that I own this. And so whether or not this is a good experience for this patient or family is entirely really up to me.
Yeah, definitely. And something else I think I am still working on learning is professional disconnect, because I do get that sense of like I now own this situation, but it's there's a definite challenge in not getting too attached to that situation, not feeling like I'm at fault if something happens. Um, you are there, you are providing care, you are with the patient and with their families, and you are doing the best that you can do. Um, but sometimes things are going to happen, and it's so hard to like distance yourself emotionally just enough
Yeah.
to be present for the patient and their families in a supportive way, but not take it home with you later. And that's something I'm still working on that one for sure.
Well, let me tell you, it took me a long time to find that balance because I'm a very, intentional and engaged individual with my patients. But you're so right. Knowing kind of, okay, I went a little too far there, and it was more about me than it was about the patient. Um, it takes time. How are you learning that? Like how is someone teaching you that? Are you watching people? Are you just going too far and being like, "Oh, yeah, that was too close. I need to pull back a little." And then, "Oh, I really am not engaging with my patients. I have to engage further." How are you finding that place for yourself?
I think it's sort of like a multi-pronged approach. A lot of it is reflecting on my own practice. So looking at interactions that I've had sort of as an ongoing process throughout the day, but also at the end of the shift being like, was I present enough? But also, am I taking anything home that I shouldn't be taking home with me? But then also touching base with my charge nurse or the clinical learning specialist for the ED, and just saying like, this is sort of what happened. Do you think maybe I was too close or not close enough? And so it's sort of like a multi pronged approach, I would say, to learning that skill. But a lot of it really is reflective practice. I would say in nursing school, they're always touting like reflective practice. You have to reflect all the time, and you're like, oh God, I'm so tired of reflecting. Please ask, like, don't ask me to reflect anymore. But the truth is, you're reflecting on your practice every minute of every day, realistically, to say like, do I need to, for this particular patient, even, do I need to be a little closer? Do I need to be a little bit further away? Like, does this family need a little bit more of a hand holding approach? Do they need me to not be there very often? And so there's a lot of reflective practice. I apologize to all the nursing students who might see this. you're going to be like, no, reflection. Um, but it's the truth.
I
And you're,
never saw it.
yeah, we thought we were done. No, you're gonna be reflecting constantly.
So what does that look like for you? I mean, do you journal? Do you do audio tapes? Do you talk to a friend? What do you do?
Usually it's just sort of ruminating on my way home, to be honest with you. Sort of debriefing with myself, I guess, as I drive home from the hospital. But sometimes it's talking it out with, colleagues, especially if something happens, good or bad, being able to get my feelings out verbally into the universe and say, like, this is what happened. Did I make the right choices? Did I do what I should have done in this situation? Is really a valuable tool as well. I've never been much for journaling personally, but I can see how that would also be a very valuable tool. It's just not something that I personally do a lot. I'm more of a like internal rumination kind of person. And then, yeah, sometimes being able to have an actual structured debrief has been a very valuable tool as well. Like debriefing with the charge nurse after, critical incidents has been helpful.
I mean, is that a routine practice in your ER?
Yeah, I mean, I would say it's quite a commonplace practice to have even like an informal debrief, but we do get structured debriefs as well for critical incidents. I remember not that long ago, one of my patients decompensated very quickly. I had been in to see them about 30 minutes before, and I went back to do a simple walk test to see if they were ready to go home, and they were completely unresponsive. And so that was sort of one of my very first, I would say, like critical incidents on my hands. I went, had somebody go get the doctor, got some extra help. And then afterwards, the charge nurse came to me and said, like, how do you think that went? Like, first, are you okay? Like, how are you doing emotionally? How do you think it went? What could have gone differently? And that was very valuable to me to have a moment to just sort of take a breath. Um, because I think something that I never anticipated was in fast-paced environments, something bad will happen, but you have to keep going afterwards immediately, pretty much. So being able to have even 5 minutes to debrief with the charge is very valuable reset time.
Yeah, that's a really good point, right? That these things are going to happen. And right now, I mean, even just basic acute care is hyper acute care.
Mhm.
And so things are going south and you're having to reconstruct your workday frequently. But you're right, sort of taking that time immediately before you go and engage with someone else because you're pulling that with you. So how do you say, okay, that was that, and this is this? Even 5 minutes of just talking through it with someone you're saying has been helpful for you.
Yeah, absolutely. Because, yeah, I mean, even if something happens to one of your patients, you've still got 3 or 4 or 5 other patients to think about after it's all done. And that can be really challenging, actually. You leave a critical incident, you've been working on somebody for 30 minutes, 45 minutes, an hour, and then the minute you're out trying to take a breath, somebody else needs you. And that's a very challenging dance as a new grad, because it can feel very exhausting. Like nobody cares that you just went through something really awful and hard, um, and you're expected to just like get back to work. It's not that people don't care, they do, but that's how it can feel, I think, as a new grad is like, wow, I just had one of the hardest hours that I've had so far in my nursing career, and now I got to get ice chips for bed too.
Exactly.
Like,
I've got to appear as though nothing just happened.
yeah.
Uh, when my emotions are just tumultuous, and for me as a critical care nurse, when I think about everything that I saw over my career and how rarely I was debriefed, right? And I came to like I didn't even know what debriefing was when I was working in critical care. That's how seldom we were debriefed. But it would catch up with me. and I burned out a couple of times because I was just, doing one of these with all that had happened that day. And nobody approached me and said, "How are you?" Let's sit down and talk about what happened with this patient today. So I'm so excited, Tiffany, to hear that that's something that you don't have to ask for necessarily. Although I do want to ask you, how do you ask for that? Like if you're advising new graduates coming in now, how do you advise that they ask for that kind of support? Who would they go to? What would they say?
Yeah, I mean, that's a really good question because while I have been very privileged to have um, people that reach out sometimes right after an incident, sometimes I have had to go and ask for help as well. And I think it's sort of who you go to depends on the level of what just happened. Sometimes it'll be like, one of the other nurses on the floor, can we go to the med room because something wild just happened and I think I need a second opinion here. Like I just need to talk about this. And then sometimes it's going to your charge nurse and saying, hey, listen, this thing just happened. When you have a few minutes, I would really like to talk to you, because I want to
Mm.
know that I did my best. And that I did what I needed to do and what was right to do. And I think it can be kind of scary to ask for that kind of help, especially again, it's like I am on the line with the same charge nurses that I oriented on. So I already have a relationship with those charge nurses, and that makes things a lot easier for me to go to them and say, like, hey, this thing just happened. When you have some time, can we talk about it? Um, but I think just approaching it and saying, listen, I really think that I need to talk to somebody about this. Um, and then being able to sort of like ask them when they have time, can you please come and see me? Um, because we're all busy juggling all of our thousand tasks all the time. So it's not always reasonable to expect that somebody can debrief you right after something happened. But hopefully they'll be able to see you as soon as possible. Because you're right, like pushing it down, bottling it down, not really in the long term going to be very good for you. And something else I think I didn't realize is that it hits you weird times too. You might be perfectly fine right afterwards. You might be perfectly fine for the rest of the day, for the rest of the set. And then all of a sudden, in the middle of your time off, it hits you like a ton of bricks. And you're like, whoa, I thought I was good at this. Like, I thought I was okay. And that's okay too, to
Yes.
for it to hit you later. That's fine.
I agree. I mean, I think they're going to hit you whether you get that support or not, right? Because you're just processing it. It's like, when we go to bed and we have these crazy dreams and we're like, I don't know what that was about. Well, it was your mind working through something in its own way. And I
Mhm.
do believe that is what happens. I do also believe that it softens that fall, if you are able to have that quick or extended debrief with a seasoned colleague who's sort of been there, done there, bought the t-shirt. And I do think that helps. So the problem with new graduates, as you well know, is that anxiety initially, I don't know these people. They're going to think I don't know what I'm doing. They're going to think I can't cope. They're going to think all these things about me, when in fact, they're most likely not going to think those things. They're going to be like, "Hey, I understand completely why you are anxious about this situation. So let's talk about it." I do think that shift is happening. Whereas when I grew up in nursing, there was no talk about, let's debrief, let's talk about this situation. It's like just move on and away we go. So I do think that's changing. I'm really excited to hear that, Tiffany, and I loved your advice.
Yeah, I love that that shift is happening too. And I've seen it even just in the few years that I've been in nursing school and the previous experience that I sort of had in the medical field. I've seen the shift happening myself where it's like, it's okay to talk about it and it's good to talk about it. In fact, it's not something we should be holding on to. Um, and I know that there are lots of challenges that have sort of come forth with COVID. Um, a lot of burnout, a lot of overwhelm. But I think one of the positives that have come from it is that we've decided as nurses that we do need to be talking about these things. We can't keep bottling things up. We can't keep moving on pretending that the horrible things that we've just seen are normal and commonplace. They're not normal or commonplace, and it's totally okay to be upset about it. I had this idea in my mind that to be a nurse, you had to be like rock solid wall of like no emotion. Like you had to not let anything touch you. That's not true. Like you I think if you get to the point where the things you see don't touch you in some way, that's when you need a break.
Oh, you're just speaking to my heart, girl. Those are all the things that I was hoping would come from our chat. I'm thrilled, Tiffany, and I know that we have to come to an end, but I'm wondering if there's any advice that you have for grads, because there are a number of grads interested in these high acuity areas. Could you summarize what you would advise them?
Yeah, absolutely. So I would definitely advise that you take on some additional training, either if your program offers a critical care elective, or if you can do maybe like the TNCC or even like ACLS, just so you have a little extra sort of acuity knowledge there. Don't be afraid to ask for help. Lean on your coworkers. Do not ever feel like you are a burden to them because you're asking questions. It's better for you to ask a question that maybe you're like, is this a dumb question? Than for someone to get hurt because you didn't ask. That someone could also be you. You shouldn't be getting hurt because you were too afraid to ask. And I know that there's a lot of anxiety and it's a very scary time, especially if you don't know your coworkers that well. But ask. The temporary momentary sort of anxiety of having to ask is worth it in the long run, and you will feel more comfortable. um, take the time for yourself to debrief in whatever way you find the most effective. For me, again, just like sitting in the car on the way home thinking about my day, like, what happened, what could I have done differently? Sometimes it's chatting it out, sometimes it's journaling, sometimes it's music. Whatever way that you need to take care of yourself, I would definitely recommend that. And give yourself grace. Give yourself grace is my biggest piece of advice. You are going to mess up sometimes. You're not going to know what to do sometimes. And it's okay to not know what to do sometimes. Um, but just don't be afraid to ask for help when you're unsure, and go easy on yourself, because you're going to be your hardest critic all the time. You're going to be harder on yourself than anybody else will.
Oh, what a beautiful segue to the end of our session together. Thank you, Tiffany. It was truly a privilege and a pleasure to talk to you about your work.
Thank you so much for having me, Judy. It's always so nice getting to chat with you, and I'm so happy to be able to talk about the new grad experience and hopefully help somebody else make the transition. Because it's a big leap, it's a scary leap, but it's so worth it.
Oh, that's so great. So thank you so much, Tiffany, and thanks to everybody for watching, and we'll see you at the next interview.